Hi everybody, I'm Shalia. I'm the Physician Associate at Ward Institute. Today we're going to be talking about CO2 laser treatments for the full face. CO2 laser is one of the most powerful cosmetic lasers out there. With the CO2 laser, we're causing a very controlled burn of the skin. This inflammatory process stimulates healing, which allows the skin to tighten even better than it was prior to the injury. This tightening results in better fine lines, wrinkles, droopy eyelids, thin droopy skin, and even dark spots on the skin like freckles or age spots or sunspots. So what should you expect during your CO2 laser full face treatment? Well, we begin the procedure by injecting numbing throughout the whole treatment area. This can be a little bit uncomfortable for a couple minutes, but afterward you shouldn't feel any pain. You may feel small amounts of heat, but it shouldn't be painful. Typically, patients describe this as a little bit of a hot rubber band snap on the skin. Now, if you need to add numbing at any time during the procedure, we can absolutely do that. I also like to prescribe you a very strong numbing cream that you can apply even before you come to the office to maximize your comfort during the procedure. So don't worry too much about the pain. Most patients do very, very well. Directly after the treatment, you'll look kind of charred, a little bit burned, maybe a little bit bloody, and will have a lot of greasy ointment all over you. It may feel a little bit like you've had a bad sunburn for somewhere around 24 hours afterward. After that point, it really shouldn't be painful. We give you very strict cleaning regimen, so we'll give you instructions on how to clean the face, what products to apply. During the first week, it's very important that you follow the cleaning instructions and all of the post-care instructions, including staying out of the sun. This is very important, as going into the sun during this critical healing period can lead to scarring or pigmentary changes of the skin, like light spots or dark spots. Usually around day 4 or 5 of the healing process, you'll enter the sloughing phase. This is where all of that dead, damaged skin that we burned during the treatment starts to slide off. It looks a little bit flaky or clumpy because you have a lot of ointment on there. It can even sometimes have a little bit of a foul odor to it, but don't be too alarmed. Once all of this dead skin comes off, you'll be feeling a lot better. That sloughing process can take a few days and can actually be quite itchy. There are lots of things that we can do to help the itching during those few days, and that's something that we'll discuss ahead of time to get you ready for it. It's very important that you do not scratch, pick, or otherwise disturb the skin during this healing process for the first 1 to 2 weeks. After the first week or two, depending on how quickly you heal as an individual, your skin will be ready to go out in the sun. At this point, you'll be very, very red, but you can at least wear makeup over it. I do want you to always wear sunscreen over the red skin during the healing process. I recommend our Form RX sunscreen. We even have a lovely tinted version that helps it to kind of blend with the redness. It's important that you wear this sunscreen during the rest of your healing process and ideally through the rest of your life to reduce the risk of pigmentary changes. While it is important that I perform the laser well, it's equally important that you care for your skin afterward. This means cleaning and treating the skin as directed afterward and staying out of the sun. Now, to help with this whole process, I like to add on a lot of extra things to help you out. One thing is that a couple of weeks before you even receive your treatment, I'll give you a complimentary tox treatment, Botox or Dysport, to the face. While it seems like this might just be a nice add-on, it really does have an important purpose. Tox will soften the muscular contraction of the face, making it harder for you to form wrinkles. This means that during the healing process, you won't be disrupting the skin as much by wrinkling the skin. It will make it more comfortable, and it'll make your results that much better. Also, before you ever get to your appointment, I give you a CO2 skincare system from our Form RX line. This is filled with loads of products that are going to help you to be comfortable, stay clean, and improve your results during your healing process. On the day of your treatment, we'll also draw some of your blood and prepare that blood into PRP, or platelet-rich plasma. We apply this topically over the laser-treated area afterward in order to improve the healing and comfort of the area. After I've done my part in the office, it's your time to shine. This is where it's very important for you to follow the cleaning instructions, apply the products as we're directed, and for you to stay out of the sun. Now, my two greatest tips for post-CO2 healing are to, number one, stay moist, meaning that you apply the products and that you apply ointment liberally afterward to keep the skin from drying out. Dry skin is cracked skin, and cracked skin can allow bacterial infections and scarring to form. So stay clean, stay moist, and I also highly recommend that you stay out of the sun. This can cause pigment changes that are more permanent. Probably the most common question that I get is, does it hurt? Now, the numbing procedure at the beginning, where we inject numbing throughout the face, is probably the most uncomfortable bit. It only lasts a few minutes, and after that, you shouldn't feel any pain from the procedure. I also give you a prescription numbing cream that helps significantly as well. During the procedure, your skin may feel pretty hot because of the laser treatment. We do a lot of things to help with discomfort as well, namely using cold air over the area and wet, cool gauze in order to decrease the heat of the skin. This seems to help a lot, and most patients are very grateful for it.